Kia ora koutou, and thanks, Ananda, and apologies again for not being able to make it to the conference again. I think the research that we're going to present on next year is on how to be in two places at once. That seems relevant and topical, doesn't it? So for today, what we're going to talk about is feedback-informed therapy. All right, to talk a little bit about feedback-informed therapy, or FIT, and how we've used our FIT outcomes to really guide and improve our therapy outcomes. So real quick overview, FIT is based on a really simple yet transformative premise that regularly inviting client feedback can really help shape our therapeutic approach. By listening to clients' experiences and outcomes, we really create that continuous feedback loop that enhances the therapeutic relationship and helps make us or helps allow us to make informed adjustments in real time. So this was developed by Dr. Scott Miller and his colleagues overseas, and I'm not going to get into the whys and hows and whats of FIT. Just know that it is decades of research behind it and has been used in a lot of different areas. To our knowledge, this is the first time that we're using FIT, or we're seeing FIT used in group EMDR using the GTAP protocol. So another first for Whakaora, right? So this culture of feedback. Really at the core of FIT are two really practical tools, the outcome rating scale and the session rating scale. The ORS tracks clients' overall well-being, while the SRS measures the quality of that therapeutic relationship by inviting clients to really rate their experiences within the session. And together, these really brief 4-item scales give us that vital information that might otherwise go unspoken. So in our practice, we've consistently used the ORS and SRS to monitor both client progress and our therapeutic relationships. In addition, we ask a qualitative question about positive changes that clients have noticed since starting treatment. This is a slight deviation from Dr. Miller's FIT approach. And man, I'm here to tell you, qualitative research is hard, but we've got the data. So we're going to talk about that in a minute, but we're going to start with that quantitative information. So starting with the ORS, and I'm showing you the ORS on the screen, I'm not going to get into how to administer it. That's way outside the scope of this presentation. Our ORS results showed meaningful improvements across several key areas. So personal well-being, relationships, social engagement, and that general sense of well-being. So in FIT, a change of 5 points on the ORS is considered a reliable change indicator. And that reliable change index really just indicates that any score increase of 5 or more points can be reliably attributed to the therapy process rather than chance. And many of our clients surpassed this threshold, which suggests that the positive changes we're seeing are indeed related to their treatment experiences. The SRS results revealed really strong scores in areas like relationship, so that's that therapeutic relationship, goals and topics, so what we worked on in the GTAP session, and that overall therapeutic approach. So again, that is the GTAP protocol and clients telling us, hey, is this working for me or not? High scores here signal that clients feel connected to their therapist, they're engaged in working on meaningful goals, and they're satisfied with that therapeutic approach using that GTAP protocol. In FIT, a strong therapeutic alliance, as measured by the SRS, is really critical because research shows that it directly correlates with positive treatment outcomes. So in other words, when clients feel heard, respected, and aligned with their therapist on treatment goals, they're more likely to achieve meaningful progress. So we're not going to go into all the data from the surveys, but as a quick overview, here's how our EMDR approach using the GTAP protocol was viewed by our participants, right? So on a scale from 0 to 10, well, I'll let you be the judge. And here's a quick look at our overall session rating scale scores. As a quick reminder, the full data set, including recent survey results, is available on our online data dashboard at whakaora.org. So head on over to whakaora.org. You can see the full data set and what we've been working with over the last several years. So in addition to these quantitative measures, we asked clients to describe any positive changes they had noticed in their lives since starting treatment. This open-ended question gave us a whole bunch of different insights. And from analyzing these responses, we've identified a few recurring themes. So improved coping skills that clients really frequently mentioned feeling more capable of managing their daily stresses and emotions. They noted being less reactive and handling things better. In the trauma processing, many clients shared that therapy provided a safe space to revisit and make sense of past traumas. They described this as a transformative experience, some even reporting a reduction in flashbacks or other trauma symptoms, which of course we saw on the clinical outcomes that Ananda has discussed, and it's great to hear it in their own words as well. Of course, other clients talk about feeling more open and having an increased ability to open up, especially regarding sensitive experiences and positive emotional shifts that we saw clients report kind of those broader emotional benefits, such as feeling happier or relieved, experiencing a lighter outlook on life. Not too bad, right? So the qualitative feedback underscores the data captured by the ORS and SRS, really showing that the therapy process was not only statistically impactful, but also meaningfully experienced by clients in their everyday lives. And our results really reflect key aspects of fit theory, kind of discussed throughout the literature, and really fit suggests that a feedback-rich environment empowers clients, creating a space where they feel safe to express what works and what doesn't. This culture of feedback really aligns with our clients' reports of improved coping and openness and positive emotional shifts. So remember that fit isn't just about tracking scores. It's about responding to what these scores reveal and meeting our clients where they are. By actively using the ORS and SRS, we're not only monitoring progress, but also ensuring that our clients' voices guide their journey towards healing. We know from the literature that a reliable change on the ORS, that 5 or more points, is a strong indicator of positive treatment impacts. And our clients' progress reflects this, really enforcing the practical value of routine outcome monitoring in achieving meaningful therapeutic outcomes. So just to wrap up, our use of FIT with the ORS and SRS at the core has really provided us with those actionable insights that really enhance that therapeutic alliance and client outcomes. With that, I'll hand back over to Ananda.